So all right, so looks like 28 people so far. Before I get started, I just wanted to ask, so I can tailor the content of my presentation. What's the youngest age of the people who are participating today? 13, okay.
Yeah, 13, yeah.
Perfect, great. Okay, so probably going into 8th grade, middle schooler. Fantastic. Okay, this is a great age. Okay, 29 people. So my name's Dr. Smith. I'm a pediatric dentist, and I got introduced to the youth and pre-med group through my niece, Liz Forcell. She's going to be a sophomore at Burlingame High School. She's one of the participants in your group. And I think it's a great organization that you guys have put together and participated in, because when I was your age, I would have loved to have something like this. There's nothing like this in my middle school or high school. And so I kind of had to figure it out on my own. So this is awesome. Great job, you guys. And I actually just, one of my patients the other day said she wanted to be a doctor when she grew up. So I gave her your guys' contact information. So in the future, if I hear that from other patients or kids that I know, teenagers that I know, then I'll definitely share the Youth and Pre-Med website and contact information so that they can join you guys. So, so is it okay if I share my screen now? Yeah? Okay, thumbs up, cool. So I'm going to share my screen, and thanks to my niece, Liz Forcell, she helped, she found this really cute slide design with teeth on it. So hopefully you'll find it entertaining, really cute design. Really fits what I do, which is pediatric dentistry, working with kids. So. Awesome. Okay, can everyone see my screen with the little teeth and the toothbrush? Awesome. Okay, so this just slide just kind of encapsulates why my job is really awesome, because I get to have fun and hang out with kids, babies, and teenagers. Being a dentist is a pretty serious job, but as a pediatric dentist, along the way, we get to have a really good time. I get to show kids Disney movies. I get to talk to them about toys and sports and what they're interested in. I get to teach them a lot about their health and how to keep their teeth healthy. But every day, like a kid, like usually like a 2 or 3 year old, they laugh, they say something hilarious, and I'm always enjoying getting to know my patients and learning a lot from them too. So first question is just really good one. What does a pediatric dentist do? So you'll see in parentheses, I have AAPD. AAPD is the organization that I belong to as a pediatric dentist. It's called the American Academy of Pediatric Dentistry. And basically, before you become a pediatric dentist, you have to become a dentist in general. And then once you're a dentist, you could choose from several what we call specialties. So like as a doctor, you could be a family practice doctor or pediatrician, you could be a surgeon, you could be a dermatologist, psychiatrist. I know you guys have heard from those type of specialists in the past. And then in dentistry as well, there's also specialists. So pediatric dentistry is a specialty that's defined by the age of the patient. So specifically, pretty much anyone 18 years old and younger falls into the category of my specialty. That includes children as early as birth, if they're born with teeth, which happens occasionally, typically around 1 year old, up into teenagers. And usually I will see patients until they graduate from high school, go off to college. And then it's time for them to go on to what we call general dentist, is a dentist who can see adults. Some pediatric dentists will do research in a university or other setting. Some of them will be teachers, they'll be professors in a dental school. residency program. And then the majority of pediatric dentists like myself will be in providing clinical care, meaning we care for patients either in a group setting with a lot of pediatric dentists, a small on your own, like one person working in an office by themselves. And then we work together with other health providers. So that would be, we work together with pediatricians, other medical specialists, depending on the medical needs of the patient, as well as orthodontists and other types of dentists. And then the other thing that we do that's really unique and special and has this important place in my heart is that we are in charge of caring for children, as well as, if needed, potentially an adult with special healthcare needs. Special healthcare needs include conditions like autism, Down syndrome, heart conditions, lung conditions, what we call developmental delay, basically a variety of conditions that a child may live surgeon will, and then we'll see children when they're in the operating room. And then something that we also do is we'll have a type of medical doctor called an anesthesiologist come into our office, and we'll see children under something called sedation or general anesthesia. Back when I was in kindergarten. So I had this little like art project where you had to say like my favorite color, my favorite toy, what I want to be when I grow up. And my my thing that I said that I wanted to be when I grew up was a doctor. And that was mainly my parents were doctors. So that's what I thought you did when you grew up. And so, but also just because I already looked up to my parents and I saw the impact that they had on our neighbors and our community and people that we knew, they were able to help them and make a difference in their lives. And then I remember this conversation I had with my mom. I was older, probably like in middle school. And I said, oh, Mom, I want to be a doctor. So I need to start studying science and stuff like that, just like you guys are doing. And then my mom said, well, you need to know that there are different kinds of doctors, many different kinds. And then she walked me through, I put on the screen for you some examples, what are different ways to become a doctor. She said, a doctor is a level of education. It doesn't mean just a medical doctor like she was, my dad was. It could be a juris doctor. Said, what's a juris doctor? Juris doctor is a lawyer or attorney. Doctor of pharmacy. So when you go to CVS, Walgreens, and you have to take some antibiotics or medication for like acne or something that you have, then those medications would be taken care of by a doctor of pharmacy. They're a doctor too. Of course, everyone knows medical doctors. And then also doctor of philosophy, which contribute a lot to our body of knowledge, academics. So there's many different ways to be a doctor. And then she said, another type of doctor is a DDS, doctor of dental surgery. I said, what is that? She said, it's your dentist. I said, oh, well, at the time I thought I wouldn't necessarily want to be a dentist. I had a ton of cavities, didn't seem like totally interesting to me to go be a dentist. And then the next time I went to my dentist, talked to him about his job, and he was super enthusiastic about his job. He loved his job. His name's Dr. Kim, and he's still an amazing dentist. And then I kind of thought about it. And then actually when I was around some of your guys' age, I was 16 years old. That's when I really realized that I wanted to be a pediatric dentist. So how on earth did I get from playing with Legos and Play-Doh? This is my son earlier this week actually playing with this little Play-Doh dentist kit. You can see there's a little Invisalign there. He's using a little drill. and he's trying to make like a tongue and stuff out of Play-Doh. He's 2 years old. So along the way, there was a lot of things that I did as a kid and a teenager that, looking back, really set me up for success as a dentist today. So one of the main things that I kind of attribute my success to is playing with Legos. So Legos basically help you put things together in 3 dimensions. And as a dentist, you have to reconstruct teeth whenever they're destroyed by cavity bacteria, using a variety of materials. We call them fillings. There's other things we'll do, sealants, crowns, etc. And Legos, when you're a kid, even if you're a teenager and you're like, I've never played with Legos, it's never too late to build stuff. Like nowadays, we call it like being a maker. Also, like learning how to code is kind of a way of like almost like Legos, but with computer code. Even playing video games honestly teaches you like 3-dimensional skills. And then Play-Doh. So that's kind of like early art skills for kids. Play-Doh is like a form of what we call sculpture. So if you have art classes in school, or even just in your free time, drawing, painting, sculpture, pottery, jewelry making, I mean, really any kind of art, any kind of 3-dimensional play, those skills really help you see if you're kind of interested in working with your hands, because that's pretty much what you do as a dentist. So when I was in high school, I started getting some experience and asking if I could get involved. So some of the things that I did, very simple. I babysat kids in my neighborhood, and that's how I learned that I really like working with kids specifically. And that's how I decided I want to have a job that works with kids. And my number one choice was pediatric dentist. And then if I couldn't do that, I thought I would either be a teacher or maybe a pediatrician or something with kids, specifically like young kids, 2, 3, 4, 5 years old. And then my mom was a doctor. She had her own practice. So after school, when I had the time, and in the summers, I would work in her office, and I would just help out with paperwork, just little basic tasks. But I started learning my, sort of forming my familiarity with working in the medical setting. And then my dad was a pediatrician. And so I went into his office and shadowed him for a day. And that really, even though I was only like 15, 16 years old, that's how I really learned that I wanted to be in the medical field, but I didn't want to be a medical doctor. So he saw patients all day long. And first of all, I think pediatricians are amazing and I love them a lot. But he saw kids all day long and he had to give a lot of shots, and they all had colds and runny noses and coughs. And I realized that a lot of people, when they go to the doctor, they go because they're sick, because they have a problem. And with dentistry, sometimes they are sick. They're tooth has an infection, or they're in pain, they have a problem, and I'm there to help them. But a lot of time they're there because we're just helping them guide their growth, helping them be healthy and make sure that their teeth stay healthy, and helping make sure that their teeth grow in properly. So I get to see a lot of kids when they're feeling great. They don't have any pain, they don't have any problems. I'm there just to help keep them healthy. So it's like I was able to find something where I can work with kids that are feeling good, as opposed to more seeing kids when they're having like a medical crisis. So that, I realized that fit the bill for me. And then I also shadowed my orthodontist for a day. That was fun. I think being an orthodontist is another really cool profession. And then I talked to my general dentist, Dr. Kim. So even as a teenager, even 13, 14, 15 years old, you can already kind of like, you can always reach out to your dentist and find out if you could set up a day to shadow them. It's much easier to shadow a dentist than it is to shadow like a medical doctor, because most medical doctors will work for a big company like Kaiser, Sutter, UCSF, and it's a big program to be able to get a teenager to go into a hospital like that. But oftentimes dentists will own their own practices, so they'll be able to make their own rules, and they could have a teenager come in. One of my patients, she was a teenager interested in becoming a pediatric dentist, and she shadowed me, I think, for like a week on her spring break, and now she's in dental school. So it's really cool. That was a while ago. So if you like kids, being a pediatric dentist is a wonderful profession. If you like art, science, and for me, I love teeth. Now, you don't have to love teeth to become a pediatric dentist. That's just kind of, I think teeth are beautiful. I think they are fascinating. And I just always like to tell people who are interested in becoming a dentist that, or medical doctor, that teeth are just a part of the body. So just like an eye doctor studies eyes, cares for eyes, a dermatologist cares for skin, a dentist cares for teeth. So it's just a part of the body. I wanted to be a doctor, help people. And then also this one was big. I really wanted to work with my hands and work with people as opposed to working on a computer. So a lot of jobs nowadays, particularly, I'm sure, especially by the time you guys enter the workforce, it's all computer based. So I really didn't like looking at screens too much, even when I was a teenager. And I wanted to have something where I could like be with people one-on-one. And the pandemic really proved that. You know, you could do telemedicine for a lot of things where you could consult with your doctor, dermatologist, you know, say, oh, look at my skin over the Zoom meeting or video platform. But it doesn't really work for dentistry because you need to look inside the mouth. So I was still able to, throughout the whole pandemic, maintain connection with my patients in person. Of course, wearing all the proper protective equipment. So how did I get from there, being your guys' ages, to now? So right now I'm 38. So I've been a pediatric dentist for 8 years. And it took a long time. So that's a little copy of my scrub shirt, 2013. That's when I graduated from UCLA, pediatric dentistry program. And a year later, I became board certified through the American Board of Pediatric Dentistry, which is a long process. I'm sure some of the other speakers have talked to you about board certification. There's board certification in dentistry as well. And then I put a little conversation box there that says getting there is half the fun. That's because it's never too early, whether you're 13 or 15, to kind of put it into your mind that it's not about reaching the destination. You want to achieve your goals, obviously. Like in order to get from 16 to 30, a long process to become whatever profession that you guys want to do, whether it's a dentist, doctor, or engineer, whatever you want to do. It's a long process, but it's not about getting to that destination. It's also about learning and having fun along the way. A lot of my friends who are practicing dentists now, they will look back. They look back from the days we were in dental school, working, 10, 14-hour days in school, and say, wasn't that so fun? That was like fantastic. Like we had such a great time. We missed those days. And the reason why those days are so wonderful is because you're learning so much, and learning is exciting. It's good for your brain. It's good for your mental health. It's good to learn what you want to learn. So part of what's kind of challenging about middle school and high school is you have to establish the foundations of everything that you need to succeed as a citizen in our society. You need to learn math. You need to learn English. You need to learn all the government, all the basic skills. Everyone needs to do that. But what's fun after high school is then you can start focusing on things that are really special to you as an individual. So for example, when I graduated from high school, then I was able to go to college and study a field called human biology. Human biology is the biology of people. So not only do you get to learn about cells and physiology and anatomy, but you also get to learn about psychology, sociology, anthropology, basically the physical side of people, but also the emotional side of people, the social side of people. So it's a really fascinating field to study. And I really, really loved it. After I went to college, then I worked for a couple of years at a nonprofit organization in Burlingame, which is where my practice now is. The nonprofit organization runs homeless shelters for families and for individuals in San Mateo County. I did that for 2 years while I was prepping my applications for dental school and taking the necessary tests. So I was really fortunate and happy to be able to go to my dream dental school, which is UCLA School of Dentistry in Los Angeles. You guys probably heard of UCLA for college. It's a great school. I think there's around 60 or so dental schools in the US. And so there's a lot of great options all around the country. And the most close dental school to us here in the Bay Area would be in San Francisco. There's two schools, University of the Pacific and UCSF. And they both have, I don't know about right now because of the pandemic, but under normal circumstances, they have programs where high schoolers can kind of like get a tour and meet up with some of the dental students to see what they're learning about. After I finished at UCLA, that was 4 years. Then I did a residency program at UCLA. Just like medical doctor does, we have residency programs, and pediatric dentistry is between 2 and 3 years for the residency program. You do research, you do teaching, you work in the hospital, you work in the clinic, and you're trained to see children, particularly those with a variety of healthcare needs. So sometimes we would have children travel 4 or 5 hours from their town in California where there were no pediatric dentists or no pediatric dentists that were comfortable treating their condition. And then they would come to see us. And so that was a really special time in my life. I had wonderful patients. And also because I was in LA, I would say about 90% of the patients that we saw there, the parents' native language was Spanish. So the studying Spanish in high school, which probably a lot of you guys are doing, served me well because I was able to speak Spanish to my patients, and more importantly to their parents to be able to communicate with them. So, you know, all those things that you're studying in high school, they really do pay off, just sometimes not when you think they will. You just never know when you're going to need all those skills. So that was 10 years after high school that I needed to do. This is like a little, supposed to be me. I have red hair. That's me in my drill, and I'm holding a tooth's hand. I thought that was cute. Thanks, Liz, for that. So this is just a list of honors and awards. And the point is not to say like I'm an amazing dentist or anything like that. It's just to show that like when I was in college, I was studying human biology and I did fine. I did everything I needed to do, all the prereqs. The prereqs for dental school are almost exactly the same as the prereqs for medical school. It's basically all the same science classes that you need to take in college. And I did fine in college. You know, I was a good student, very dedicated. But then when I got to dental school, because I really, really like loved dentistry and I loved the science of dentistry, then that's where I really thrived for the first time. Well, not the first time in my life, but that's where I thrived most, I guess. And so when I graduated at the top of my class because I loved what I was learning. I would learn it and then I would relearn it like 2 times because I just wanted to like soak it up like a sponge. I didn't think of it as something like I had to do to get my diploma, but something that is like I was meant to do. So I think whenever I kind of approached a school subject like that, like I really want to just not like something I have to check off my to-do list, something I need to get done, but something I'm just going to really enjoy doing. That's when I found my most success. When I was in dental school and before dental school and also residency, I did a lot of community service projects and public health work. So it's never too early to be involved in community service. I did that in high school as well. And then as a dental student, resident, you can do a lot of good, specifically helping educate kids who don't have access to oral health education. So we did a lot of school visits. So this was really fun. We would always go to elementary schools. We would go into the classroom. We would go to preschools. We worked with homeless teenagers that had no access to dental care. And that was always my specific area of interest, was working with homeless kids, teenagers, and families. And So it was really nice to get into the schools and help educate people. So part of being a dentist is being educated from school. I worked for 5 years as what's called an associate. An associate is anybody, whether it's a lawyer, doctor, dentist, accountant, it's anybody who works for another person as part of their practice. So typically as a dentist, you can either be an associate working for someone else, or you can own your own practice. And so not all, but a lot of dentists over time, they'll start becoming interested in having their own practice. And one of the main reasons that that is appealing is just because then you get to make your own decisions about the care that you provide for your patients. So everyone kind of does things a little bit differently. And when you build your own practice or buy your own practice, then you're able to decide how you want to treat people. And in this case, because I'm treating kids, it's really important to me to make sure that I'm able to treat them the way that I want. And fortunately, as an associate as well, I had wonderful job positions and have been able to always treat kids with a lot of love and care and felt good about what I've been doing as their dentist. So one thing that's really fun about, for me personally, about opening my own practice is that in addition to being a dentist, doing drilling, filling, extracting teeth, cleaning teeth, examining patients and all that kind of scientific biology-based stuff. I also got to use some of my art skills that I always liked. For example, designing the website to my office. So I built the website and I did a lot of graphic design. And then I also am interested in interior design. And so my partner and I, that's her back here, Dr. Zoll, we designed our own practice. So we picked everything from the book, the kids' books, the toys. That's a little picnic table that's perfect size for like a 3-year-old, to the lighting and the colors. So that has been a really fun project, and it took us over a year to build it with the construction team. And then we opened the doors of our practice about 2.5 years ago. So a day in the life, that's me, COVID era dentistry. Doesn't really look that different from regular dentistry. We just wear a couple extra layers of protection. We wear an N95 mask. We wear a surgical mask on top of it. We wear a face shield. You can see I have a surgical cap covering my hair and a surgical gown covering my scrubs. So when the kids walk in and see me nowadays, they don't really see my face. So I have to rely on my communication skills to really help them feel welcome, and also my eyes. So as you guys ask, you can still see people's eyes and they can express a lot of warmth and welcoming. Those things you see over my eyes, those are called surgical loops. Those are magnifying lenses that we use in dentistry. They're also used in surgery. You may have seen them on Grey's Anatomy when they're doing cases in the OR. And they basically make a tooth go from like this big to this big in what we can see in our eyes. So they help us do a better job and have an easier time seeing the teeth. So I just put these 2 pictures because it shows me like what I really look like. And then this is a really cute picture that my patient drew of me, of what she perceives me to look like, which I think is really cute. It's like a cartoon version of me. Okay, so a day in the life. So basically I'm going to show you these cases. I thought these were a little bit more interesting. You can look at them for a second. Usually my day starts with reviewing all the patients I'm going to see that day. I'll see anywhere from, on average, like 10 to 30 patients a day. The most patients I've ever seen is about 50 patients. And then I have a team with me. Sometimes I'll have a team of 2 people. Sometimes I'll have a team, depending on the office that I'm working, of up to like 12 people that will help me. So no dentist ever works alone. We work together as part of a team. We have dental assistants. We have front office staff that greet the patient. We have other assistants. So we work together as a big team together to help each other see all those patients. And sometimes patients will come in, they'll see their friend, they'll see their cousin or something in the office. And so we want them to have a really good experience. Sometimes when they come into the office, it's not just for a regular checkup, but it's because of a severe accident. So I wanted to bring this up to you because probably you guys have read the book called Smile. It's really popular around middle schoolers, high schoolers. And it's actually written by a woman who is from San Francisco. And she had a really bad accident when she was younger and needed to have a lot of treatment done to her teeth. So she kind of walks through in her graphic novel, like everything you could possibly need with your teeth, including braces, root canal, this thing here, which I'm showing on the top and the bottom. These are two different patients that I saw. These are called splints. This is sort of like if you break your arm and you need to put a cast on. If your jaw gets broken, then you need to, well, not you, but we as pediatric dentists, we need to put the jaw pieces back together, and then we need to splint them or hold them together in a binding position with something that kind of looks like braces. So sometimes we'll tell them, oh, you get braces for a little bit. This is super cool. But what it really is in both of these examples of these patients, in the what is that their upper jaw and in the lower case, also the lower jaw, part of the jawbone, when, like, for example, being hit in the face with a baseball bat, falling off of like a wall when they were trying to skateboard, broke the jawbone and moved it out like this. And then we had to move it back into position and then put the teeth together to hold the jawbones in place. So the most interesting cases I would say have to do with this, which is what we call trauma, accident to the teeth. And then the other most interesting cases I would say are always like anyone who has a medical condition that's rare. My goal is to help children and their families establish a foundation for excellent dental health through each stage of growth and development. So usually from 1 year old to 18 years old. It's really important to take care of your mouth because it's an important part of your overall health. We prevent pain and infection. A lot of kids get pain and infection from cavities. We want to watch them grow. We want kids to be, and teenagers too, to feel like they have skills and confidence to take care of their mouth. And then we also have a lot to do with nutrition. This is just a fun little slide to show the end of the presentation. This is my son when he was 1 year old at his first dental appointment. This is my office with my partner. And just to show that's the age we recommend kids going to the dentist, age 1. Last thing is we want you to do what you want to do. Try to learn, not just to succeed. And education is not a race. So try to just enjoy the journey, even if it's hard. So now I just want to ask if there's any questions.
Yeah, hopefully that presentation gave you guys kind of some insight on pediatric dentistry, so you know, like, if it's a field for you. I think there's a question in the chat about how rare is perfect teeth.
Oh yeah, that's very rare. That's like probably maybe 3% of people or something like that, like maybe 3 out of every 100 people have perfect teeth. So that's why most people will end up getting orthodontic treatment like braces or Invisalign. And most children by the age 5, starting kindergarten, most children in the United States will have already had at least one cavity. So cavities are 5 times more common than asthma, and asthma is the most common medical condition among kids. So cavities are a bacterial infection in the teeth. Avoid getting cavities. Okay. Most important thing to avoid getting cavities, everyone focuses on brushing teeth, which is very important. Flossing teeth, really important. But the main important way to avoid cavities is to reduce the amount and frequency of sugar in your diet. So American kids eat a lot, and teenagers too, eat and drink a lot of sugar. added sugar as well as some natural sugars too. And those sugars really feed the bacteria that cause cavities. So diet and nutrition is the most important thing. And then the second most important thing is removing the bacteria brushing and flossing, getting